So this is the last module in week 3, module 6, and we will be covering chapter 7, substance use and abuse. So if we skip on down to the objectives, we're going to be taking a look at the area of substance use, what it means, different substances, differentiation, and then abuse of. So really looking at addiction and dependence, how those two operate both on a physical level and psychologically, as well as the social factors that go along with dependence, what things in our environment contribute to dependence on substances, whether it be alcohol or drugs or tobacco. How do we help people avoid withdrawal? That's kind of one of the goals of treatment. So a lot of substance use and then talking about treatment in turn. Looking at how there are cues related to substance use embedded all within our environment and the expectancies that go along with those that contribute to people's dependence and use of. One of the most common things we hear people say when they hear of someone who got clean, went to rehab, and then went back to using is, I don't understand. They were clean, they were off, they weren't dependent on the drug anymore. Why would they go back to it? Well, it all goes into all of those related cues. That person's going back into the environment that promoted it in the first place. And oftentimes that's the case. They're going right back into the same neighborhood, the same family dynamics, the same work setting or situation. The same emotional factors are present that maybe brought it about in the first place, and all of that contributes to keeping a person dependent. We'll look at some of the trends in smoking tobacco, how that's been changing over the course of time, and understanding the patterns that are related that we see in smoking. That there is a very predominant pattern that pops out with smokers. And it has to do with when people start smoking, the pressures and the elements that are present when a person decides to start smoking, and then how that might contribute to the different social cultural differences in smoking. So we don't see smoking trends the same in every culture or even subculture, and the reason being is that each of those unique areas have their own contributing factors that play a role. So we'll look at people's reasons for smoking. We'll be looking at the addictive effects of nicotine and how smoking contributes to poor health and the diseases that are associated with it. Just to kind of segue into the respiratory system, which is huge during this chapter, we will be taking a look at the physiological system, module 4, which is all about the respiratory system, which obviously is very negatively affected by smoking and the use of drugs. So you'll be reading that along with the chapter, and this is in chapter 2. We'll take a look at the terms alcohol use and abuse, as well as the terms problem drinking and binge drinking, differentiating between the two, as well as alcoholism and what those subcategories encompass. We'll be looking at people's reasons for drinking, which can be very similar for people's reasons for smoking, but also just the developmental aspects of drinking. And again, going back to the role of learning. So we'll look at things like reinforcement and substance-related cues and how those contribute to early developmental stages of learning, and how this is why drinking and smoking are often started in adolescence because of those cues and because of all of that reinforcement associated with it. We'll be looking at the health hazards associated with drinking, as well as the health effects of drug use, And then the latter part of the chapter is targeted at preventative efforts. What programs exist to try to prevent substance abuse? How effective are they? What have we learned in terms of effectiveness? And how has this changed public policy and legal issues surrounding substance use? And looking at how we can help promote health beneficial programs that will be targeted at substance use and abuse. Education is key. A lot of times people get involved in drug use because they don't really fully understand the harmful effects of it. People hear that drug use is bad and you shouldn't do it, but they really just don't have a clear picture of just how addictive some substances can be, and that even using something one time can lead to addiction and the wanting of that substance. So hopefully you'll get a good sense of what all that means, and then as a health psychologist, what that role would entail at trying to tackle this big, huge issue. You'll get very familiar with the different categories of treatment for substance abuse, and many people try many things. Some are more effective than others, and it really depends on the person. It also depends on the environment that they're in, and it also depends on what substance they are abusing. And then we'll conclude with looking at relapse, why relapse is such an issue, and that most of the people that are in rehab programs are there due to relapse. So that'll wrap that up. Again, you'll be covering also module number 4, which is in chapter 2, which is the respiratory system. And you'll want to understand how various diseases and disorders affect the lungs. And oftentimes those are intertwined with smoking and drinking and use of drugs. But you'll also want to look at the respiratory system and how it works off of other systems like the nervous system, the cardiovascular system, and the endocrine system, how they're all sort of interconnected, and being able to explain how they are. Your lecture slides are here for chapter 7, and then your discussion for module 6 deals with the longevity chapter 7, which has to do with parental divorce. How does parental divorce impact one's health? So you'll be taking the assessment and scoring yourself, interpreting that score, telling us what it means, and then you'll be answering these questions. In the longevity project with the termites, what was the link between parental divorce and one's longevity? Did the people whose parents got divorced live longer or shorter lives? What were the effects of divorce on the Terman children as they became adults? And what role did personality play in all of that? In a culture today where divorce is so common and familiar, more so than it was for the termites, it'll be interesting to see just how negative these effects are. We tend to underplay the negative effects of divorce simply because it's common today. And sometimes we make the mistake of thinking if something is common, then it's probably not affecting us too negatively, but it couldn't be more wrong. As you'll see in the reading, it affects the termite children emotionally, intellectually, socially, and even physically. So looking at how that happens and giving some examples of how you saw that going on in some of the different termites, you'll want to be using some of those examples specifically. And that will wrap up the discussion. You're going to have your first exam this week, and it's going to cover chapters, your second exam this week is going to cover chapters 5, 6, and 7. Along with the physiological module number 4 on the respiratory system. And it'll be just like the last exam, 50 questions, 50 minutes. So just make sure that you're prepared, and the best way to prepare for that would be honestly just making sure you're familiar with the objectives for each chapter covered on the test, making sure that you can answer these questions thoroughly without looking at your notes, and knowing all the sub sort of categories within these, and just really giving yourself enough time to study before that exam. And that wraps up week 3. Let me know if you have any questions going forward. Otherwise, have a great rest of the week.